Hello, it's Dr. Rhonda Johnson, and today is Tuesday, April 26, 2022. And today I'm discussing the COVID situation in China. Well, folks, we know that the news from China is inconsistent. As the world knows, China is very strict around COVID because we saw this during the Beijing Olympic Games recently. Now, what I'm about to share comes from multiple sources. There's very little official government reports about China's COVID-19 outbreak. But what we know is that China is experiencing an Omicron BA2 and subvariants of BA2 surge. Just how bad it is, I don't really know. But we do know that China has had a strict zero COVID policy, and this approach aims to prevent viral transmission, and it's all about containment and suppression in a country with more than 1.4 billion people. So China's strict control measures have resulted in the fact that only 2% of the population has been previously infected with COVID-19. Now you compare that to the United States, and we've had at least 43% of Americans infected. But it has meant, though, that Chinese are very vulnerable, not only because Omicron is so infectious, but they have a lower vaccination rate, especially among the elderly, and their vaccines haven't been as effective. Now, according to the Bloomberg estimates, there are 71 million people in lockdown in China as of today. And I've seen some leaked videos on Twitter where there has been separation of children from their parents, people who have tested positive are being forced into isolation, and contacts are going into mass quarantine centers. Now, China's lockdowns have taken a huge toll on its citizens' mental health. I've seen, again, leaked videos on Twitter of people protesting and screaming from their apartments in Shanghai, and the number of suicides has increased sharply, and reportedly pets from people who test positive are being rounded up and killed. Now, China's economy, which leads the world in terms of manufacturing output and is the world's second largest economy, is suffering greatly. Lockdowns are estimated to be costing China $46 billion every month. Now, some may scorn the Chinese control measures, and although I wouldn't want to be experiencing these measures, I don't know enough about China's public health infrastructure or healthcare system to be critical. Perhaps their leaders believe this is the best approach for their country. And, before this current Omicron surge, China reported just over 4,600 deaths from COVID. Compare that to 1 million people who have died from COVID here in the United States. Folks, it's something to think about. Well, that's my message today. As always, my views are my own. Take care.